Searching for an answer to how to treat erectile dysfunctions can feel much like Alice in Wonderland. You chase after the one answer you need this minute, and the next, it takes a turn, just as you're about to grasp it. You've likely run into multiple names of medicines like Viagra, Cialis, Levitra, and Tadalafil, but you're no closer to a clear answer. Relax, we've got you. Viagra, Cialis, Levitra, and Stendra are names to commercialize Taladafil, the medicine devised to help out with erectile dysfunctions. On today's video, you'll find all you need to know about these drugs, their origins, differences, risks, benefits, and a lot more. But before we begin, kindly subscribe to this channel and turn on the post notification for more timely updates. Now, let's move in. What exactly is Viagra, Cialis, Levitra, and Stendra? To start with, Viagra is the brand name for the drug Sildenafil, Cialis is the brand name for Tadalafil, Levitra is the brand name for Vardenafil, and Stendra is the brand name for Avanafil. The drugs all work in a similar way, and they are all PDE5 inhibitors. What that means simply is they help to relax the muscles and increase the flow of blood to the body. As one may expect, increased blood flow in the body makes it easier for blood to get into the penis. It also allows people with erectile dysfunction, ED, to experience a lasting erection during sexual activity. Viagra, Cialis, Levitra, and Sildenafil are all drugs that act relatively quickly, and for a fact, manufacturers recommend taking the pill at least 30 minutes to 1 hour before sexual stimulation, though the timing still depends on the drug. Are there any differences between these drugs, you may ask? Of course there are. And how long the effect of each drug lasts is one of the key differences between them. Also, people use Viagra only when they need it. You take the drug about 30 minutes to 1 hour before sexual activity, and the effects last typically 3 to 5 hours. Levitra might start working faster than Viagra, but it lasts for about the same amount of time. The effect of a similar dose of Cialis, on the other hand, may last up to 36 hours, and for this reason, people looking for a long-lasting drug may choose Cialis. Finally, depending on the dose, Stendra will be effective after 15 to 30 minutes, and research shows it is effective for up to 6 hours. Now, let's talk about side effects. Viagra, Cialis, Levitra, and Stendra all come from the same class of chemicals, and some of their side effects and interactions are quite very similar. For instance, manufacturers recommend not taking PDE5 inhibitors with grapefruit or grapefruit juices because the fruit may affect how the drugs work. Nitrates will also interact with these drugs, so people should not use them together. Regardless, there are yet some drug-specific side effects you should be aware of, and they are Viagra. The side effects of Viagra include headaches, stomach pain, facial flushing, congestion, nausea or diarrhea, color blindness, and sometimes blurred vision. Interactions. Warnings. Of course, interactions with Viagra do occur, and it is good for you as a user to know about them before choosing any medication. Any drug for pulmonary hypertension may also interact with Viagra, causing blood pressure to drop to unsafe levels. A recent study in JAMA Internal Medicine has shown that Viagra could increase the risk of skin cancer. According to the study, 3.7% of skin cancer cases in men who use the drug Sildenafil might have been prevented by not taking it. Cialis. Cialis also has specific side effects, which include headaches, facial flushing, low blood pressure, congestion, dizziness, and chest pain. Warning: Cialis may have some more serious side effects. You should not use it with guanylate cyclase stimulators or blood pressure medications, as this combination can trigger an unsafe dip in blood pressure. A person who is taking Cialis and has prostate problems should avoid prescription alpha blockers, as Cialis serves the same function. It will be like an additional dose. It is also good to avoid certain antifungal medications and antibiotics when taking Cialis. And if you're considering taking the drug for erectile dysfunctions, you should get a doctor and ensure he's actively involved in your entire decision. You may not know, but decisions like this are far from what you make on your own. Whatever you know or think may not suffice. Your doctor will probably ask some questions, which may include whether or not you have a history in any of the following: heart problems, stroke, liver or kidney problems, stomach ulcers, abnormal penis shape, or blood cell problems like sickle cell anemia. And of course, these conditions will definitely affect the doctor's decision to prescribe Cialis. Levitra. Levitra isn't for you if you have a weak heart. Its side effects include headache, congestion, facial flushing, indigestion, upset stomach, dizziness, back pain, and color blindness. Warnings: if a doctor has told a person to avoid sexual activity due to health problems, they should avoid Levitra. Sexual activity can put strain on the heart, especially if it is already weak from heart disease. As with Cialis, a person should not use Levitra with guanylate cyclase stimulators or blood pressure medications, as these can cause an unsafe dip in blood pressure that can lead to fainting. Alpha blockers for prostate problems, certain antifungal medications, and antibiotics. A doctor may ask a person if they have a history of any of the following: heart problems, stroke, hearing problems, retinitis pigmentosa, an inherited eye condition, liver or kidney problems, stomach ulcers, abnormal penis shape, and blood cell problems, such as sickle cell anemia. All of these conditions may affect a doctor's decision to prescribe Levitra. People who are taking drugs to treat an abnormal heartbeat should also avoid taking Levitra. Stendra. The manufacturers of Stendra claim that it has a low rate of side effects. However, like the other treatments for ED, there is a risk of adverse effects, including a headache, flushing, a stuffy or runny nose, a sore throat, and back pain. It may also bring about vision problems, including possible sudden vision loss in one or both eyes, hearing problems, including a decrease or loss of hearing and tinnitus, low blood pressure or priapism, an erection that will not go away, and oops, that's quite creepy. A person should seek medical treatment if they experience vision or hearing loss, an erection that does not go away after 4 hours. Warnings. People should not use Stendra if they have or have had heart problems or heart surgery, pulmonary hypertension, low or high blood pressure, a deformed penis, a stroke, severe vision loss, bleeding problems, a stomach ulcer, kidney or liver problems. And if anyone has any kind of health condition, they should speak to a doctor before taking Stendra or any of these medications. A person should not take Stendra with any type of nitrate, HIV protease inhibitors, or certain kinds of antifungal medication. It is also wrong to combine the drug with other treatments for erectile dysfunctions, alpha blockers, or other medications for blood pressure. You can take Stendra with or without food and with up to 3 servings of alcohol. It is important not to drink more than 3 alcoholic drinks. For example, 3 glasses of wine or 3 measures of whiskey, as this can lead to adverse effects. When do you see a doctor? The risk of an erection that doesn't go away, otherwise known as priapism, is somewhat associated with all 4 medications. If a person experiences an erection that lasts for more than 4 hours, they should seek medical attention to avoid lasting damage. In some very rare cases, these drugs can cause serious side effects, which may include sudden loss of vision in one or both eyes or sudden hearing loss. Anyone who's experiencing such symptoms is advised to take a break on the drugs and see a doctor immediately. Who should take them? Every person is different, and a drug that suits one person may not suit another. But how do you know which drug suits you and which is ideal for your body? Through a doctor. With the aid of a doctor or pharmacist, you can choose that option which is most suitable for you. Cialis is the only drug of the 4 that has approval for use by people with benign prostatic hyperplasia, BPH, or enlarged prostate. People with both erectile dysfunctions and BPH should consider Cialis as their treatment option. Cialis also helps to improve urine flow. What's more, a person can take Cialis every day to keep the body ready for sexual stimulation at any time. This allows for some sexual freedom that may be missing with other options. Viagra or Levitra may be better for people who do not engage regularly in sexual activity and would rather take 1 pill each time they plan on having sex. Stendra does not have any significant advantages. Personal reasons may also guide a choice. Each body reacts to medications differently. Side effects vary between people, and the potential side effects may help an individual to decide which drug suits them best. For instance, if one drug causes nausea, they might consider another drug. Finally, Viagra, Levitra, Cialis, and Stendra will not cure erectile dysfunctions, but they may provide relief from its symptoms. There are many side effects and interactions to consider, but with the right choice and correct use, studies show that these drugs can help a person to overcome erectile dysfunctions and engage in sexual activity. It is worth remembering, meanwhile, that none of these drugs will provide sexual stimulation. The person will need stimulation in order to have an erection. The only way to know which drug is best for you may be through trial and error. People should work directly with a doctor to track side effects and decide which drug is their best treatment option. And that brings us to the end of today's episode. If you enjoyed it as much as we did, do well to hit the like button and share with us your thoughts in the comment section below. See you next time.